All right, I had to make a video on this because it's so interesting and you just got to talk about it. Supine hypotension syndrome. It occurs when a pregnant patient lies on their back, and it's due to a gravid uterus compressing the interior vena cava and the abdominal aorta, which is a little bit less common. Typically, it's going to be the inferior vena cava. So here's the baby, and you're lying on your back, and the baby's just sitting there compressing. It's a aortocaval compression syndrome, and it causes a decreased preload, which causes hypotension, and this typically occurs about 20 weeks of gestation and is exacerbated by rolling onto the right side. And so here we'll do a little bit of a practice question. So we have a 34-year-old woman. I'll go ahead and paste this here so you can follow along. 34-year-old woman at 32 weeks of gestation becomes lightheaded and dizzy. Her blood pressure is going to be dropping, and she improves quickly after being rolling onto her left side. Which of the following is the cause of her symptoms? Okay. So rolling to the left side is important, and we got to talk about some of these other options. Okay, so go ahead, try to answer this question. What do you think it is? All right, so 90/60, does that make you think of preeclampsia? Yeah, probably not. So this is definitely going to be our arteriocaval compression, and she's getting dizzy, hypotensive. It's going to be the compression that we just talked about. Preeclampsia, that would be not it. Why is that not it? Because that causes high blood pressure, not low blood pressure. All right. Also, this would include protein in urine. And also this happens, usually starts after 20 weeks and does not, rolling over, what would that do? It wouldn't do anything to you. Placenta abruption, that's when the placenta pulls away from the uterus early. That would be some painful vaginal bleeding, super painful, and fetal distress as well. It's an emergency and it does not improve by just changing your position. That's crazy. So yeah, pain, bleeding, serious fetal danger. Okay, C is the correct answer. D, amniotic fluid embolism. That's going to be rare and dangerous. That's like happens when the amniotic fluid gets into mom's blood. So mom's blood, and it causes sudden collapse and breathing problems. Oh, it's just horrible. Man, you'd think there'd be a better way to make a baby. And DIC, bleeding all over. There's so many problems that happen in pregnancy. Life-threatening, not something that improves by lying on your side. Pulmonary embolism, that's a blood clot in the lung that would cause shortness of breath, chest pain, and rapid heart rate. Not related to position, and pregnant women are at higher risk for a pulmonary embolism, but that's not what's happening here, right? So chest pain, trouble breathing, it's not just low blood pressure from lying down, so no. So this is just going to be late pregnancy hypotension when lying flat, rapid improvement when turned on your side. It's just a really interesting syndrome. It's supine. So supine, it's like your hands, you're holding up the soup. Supine hypotension syndrome, pregnant patient lying on their back. And the uterus is compressed, and it's compressing the inferior vena cava and the abdominal aorta. Yeah, that's all we got. We'll see you in the next video, guys.